Next is Medicare Part C. Part C is often referred to as Medicare Advantage because it offers additional coverage for select services like vision, dental, and hearing. For individuals enrolled in both Part A and B, it can be purchased as an add-on. Again, the point of Medicare Advantage is to minimize out-of-pocket costs to the patient for these types of services. Now for probably the most important part, Medicare Part D. As a pharmacy tech, you will gain most of your Medicare experience with Part D. Part D is the Medicare component which covers prescription drugs. Similar to Part B or C, individuals are not automatically enrolled into Medicare Part D and are also required to pay separate premiums. If someone decides to enroll in Part D, they will receive a separate ID card from their Parts A and B card. Unique to Part D is the fact that all benefits are provided through private insurance companies. Here we can see some examples of what the different cards can look like. The card listing Parts A and B will always look the same. The card containing the Part D info, however, will look different depending on which private insurance company is supplying it. Basically, any community pharmacy that you may work in will accept Part D plans. There are two general options for prescription medication coverage. One is the Prescription Drug Plan, or PDP, which is chosen by the policyholder, who are also called beneficiaries. The other option is the Medicare Advantage plan, in which beneficiaries can select an overall Medicare plan which already includes drug coverage. As an example, Kaiser Permanente offers this type of plan, where the individual's doctor is part of Kaiser, and their plan also includes prescription coverage through their pharmacies. If you are already enrolled in Medicare Original, then you are eligible to enroll in Part D. Again, these benefits will always come from a private insurance company. The open enrollment period for Medicare is always from November 15th to December 31st, with coverage beginning the following January 1st. Just like typical private insurance, benefits may vary depending on the plan selected. As expected, the Medicare beneficiary must cover a portion of the drug cost, and the plan will cover the remainder. In addition to premiums, some plans also include deductibles that must be met before benefits start to pay for the costs. As we discussed last week, Medicare Part D medication costs are organized into tiers. How much the member pays will depend on the tier the drug is listed under. Important to note for Medicare Part D is what's called the coverage gap, or sometimes called the donut hole. A member is said to be in their coverage gap or donut hole when they and the plan have together spent a predetermined amount of money. When this specific amount of money has been added up throughout the year, the member now becomes responsible for paying an even bigger portion of the costs. It is important to note that this donut hole is scheduled to disappear by the year 2020, but it is still a reality today. As a pharmacy tech, it will be important to understand this coverage gap or donut hole while it is still in place. You will play an important role in educating and explaining this concept to patients. For 2016, the predetermined amount of money that the patient and plan must pay to get to the donut hole will be $3,310. Meaning, Once both the plan and member have together accumulated this number, $3,310, on prescription drugs, then the patient will have to start covering more of the cost. This oftentimes catches members by surprise, and this will be where you can explain to them about why their medication suddenly costs so much. This coverage gap doesn't simply last the whole year, thankfully though. Once the member is forced to pay higher drug costs and reaches another predetermined amount of money, the plan will once again start to pay a higher portion, thus relieving the member from the burden of expensive drugs. For 2016, the amount a member must pay out of pocket while in the donut hole will be $4,850.
People who've had health insurance all their working lives, maybe like you, are often surprised to find that original Medicare Parts A and B doesn't cover prescription drugs. That's where Medicare Part D comes in. It's offered only by private insurance companies, and it helps pay for prescription drugs. You can get Part D either as a standalone plan or included in a Medicare Advantage plan. It's up to you, depending on your needs and what's available in your area. Here's how Part D works. First, it's optional, but if you want it, you have to enroll. Second, depending on your situation, you can sign up for Part D when you first become eligible for Medicare. For most, that's when you turn 65. If you decide to wait, you could be without prescription drug coverage when you need it, and you may wind up paying a higher premium. Third, Part D plans vary by company. So when you compare plans, you should make sure the drugs you take today are covered. Then review the drug copays, any required deductibles, and monthly premiums. For most people, Part D is a smart choice, whether on its own or as part of a Medicare Advantage plan. It can help you save on the cost of your drugs, help you manage your healthcare budget, and provide coverage in case your health needs change in the future. Those are the high points of Medicare Part D.